Hi, welcome to Do This, Not That. I'm Sue Self, licensed clinical social worker and behavioral health liaison manager for BJC Behavioral Health. In this segment, we're trying to understand and feel confident and competent when providing care for patients who experience delusions. Delusions are a symptom of either a medical, neurological, or mental disorder. A patient with delusions can be disarming and frustrating. While their beliefs may interfere with their lives and sometimes their care, they're not necessarily at risk for harm or needing inpatient psychiatric treatment. Don't be surprised if a patient catches you off guard and you suddenly find the conversation with the patient is not based on reality.
How was your lunch today?
I couldn't eat it.
Why, what's wrong?
I can only eat prepackaged food. That way I know they can't poison me.
If a patient is experiencing delusions, it might not be immediately apparent. In general, patients are appropriately groomed and dressed without evidence of gross impairment. A cognitive exam is usually otherwise normal. Speech, psychomotor activity, and eye contact might be affected by the emotional state associated with the delusions, but are otherwise normal. Other than the delusions, a patient can behave and interact in very normal ways. The only evidence of disorder might be in their verbal content.
How's your blood pressure been?
Well, doctor told me it was going to be high ever since I put that computer chip in my brain.
Okay, well let's just see what your blood pressure looks like.
In this program, we'll look at two types of delusions. A bizarre delusion is very strange and completely implausible for the person's culture. For example, the patient believes that aliens have removed her brain. A non-bizarre delusion, although false, is at least possible. For example, the patient believes that he or she is under constant police surveillance. So what causes a delusion? Like many other psychotic disorders, the exact cause of delusions is not yet known. Some possibilities are an imbalance of brain chemicals called neurotransmitters might be linked to delusional symptoms. They might be triggered by stress. Alcohol and drug abuse can cause delusions. A physiological brain abnormality affecting perception and thinking. There are also numerous medical conditions associated with development of delusions, such as neurodegenerative and other central nervous system disorders, vascular disease, infectious diseases, metabolic disorders, endocrinopathies, vitamin deficiencies, medications, substances, and head trauma, brain injury, or brain tumors. So what actions should a healthcare worker take? First, rule out medical conditions and medication causes. If the patient's delusions interfere with your ability to provide care, for instance, if she believes that you're trying to poison her or that the medical equipment is draining her blood and she will not allow you to proceed, don't argue. Slow down. Listen to her concerns. Explain what you're trying to do for her. Ask the patient's permission. Ask the patient if there's a way to accomplish what you need to do. If the delusion is person or object specific, like the color or shape of something poses a threat, address that by replacing the threatening item or person with someone or something the patient does not feel threatened by. Find a person the patient trusts to assist with reassurance.
Thanks for coming by to see me.
Try again later, or try having the procedure performed by a different worker.
I'll see you later.
Don't attempt to use logic to dispel the belief. Don't dismiss or minimize the delusions. Don't act alarmed, horrified, or embarrassed by the delusions. Don't laugh at the patient's symptom of psychosis. Don't encourage or inflame her paranoia. Don't assume that she can't understand what you're saying, even if her responses are limited. Do recognize that the delusions are very real to the patient. Avoid direct confrontation of the delusional symptoms. Assess for homicidal or suicidal thoughts. Respond to disorganized speech by communicating in an uncomplicated and succinct manner. Be patient and allow plenty of time for the person to digest information and respond. Document the delusions and any potential for harm or violence. Follow your organization's protocol for keeping patients and others safe from harm.
Hi, Michelle. I'm Pam. I'll be your nurse today. How are you feeling this morning?
I'm fine, thank you. How are you?
I'm great. Thanks for asking. We need to get your blood pressure. Let me see your arm.
What? No!
I'm sorry. What's wrong?
That thing doesn't take my blood pressure. What are you trying to do? You're trying to kill me. That thing will make my heart stop beating.
I'm so sorry. I didn't mean to upset you. Tell me what you're worried about.
That thing doesn't take blood pressure. That thing will give me a heart attack. Don't you know that?
I understand what you're saying. I didn't know that you were feeling that way. I have to take your blood pressure. The cuff will be tight for several seconds and then slowly release. If something beyond that starts to happen, I don't believe it will, we'll stop right away. All right? I can show you how it works on my arm if you'd like. Hi, Michelle. I'm Pam. I'll be your nurse today. How are you feeling this morning?
I'm fine, thank you. How are you?
I'm great. Thanks for asking. Someone's coming up to get you in a few minutes. He'll be taking you to radiology for the x-rays your doctor ordered.
What? No,
I'm sorry, what's wrong?
I can't go.
You can't? Tell me what's going on.
Justin's coming to see me. He'll be here any minute. He's very busy, you know, and I have to be here when he gets here.
Is Justin your brother?
No, Justin Timberlake. He's my boyfriend. He's on tour right now. I have to be here when he gets here. I can't go to radiology or anywhere.
Oh, I see. I'll tell you what, we'll get you down there as quick as we can. If anyone comes to see you, I'll call radiology and have them get you up here right away.
You promise? He'll be very angry.
I promise. Michelle, are you all right? You seem preoccupied about something.
I guess so. I'm just thinking about what I have to do when I leave here. Something very important, and it's going to be hard.
Really? What's going on?
My son, he's possessed.
Oh, he's a handful, is he? How old is he?
He's more than a handful, I told you. He's possessed. And I have to make sure he doesn't hurt anyone.
Possessed? What do you mean?
Last month, when the aliens came and got him, they replaced his brain with one of theirs. He's not my son anymore. He's one of them. We're all in danger now, and he can't be allowed to live.
Michelle, what are you thinking about doing?
He has to die. I have to do it. When he dies, we'll all be safe again.
When providing care for patients who are delusional, some key things to remember are: the delusion is very real to the patient. Delusions do not necessarily indicate the need for psychiatric inpatient care. Patients can be accustomed to not being believed and thought of as crazy or insane. Not every patient with delusions is dangerous, but if you suspect there's potential for risk, assess and act accordingly. See him or her as a real person, not as a disorder. Remember, it's easy to be caught off guard. Just keep in mind, you don't need to be a psychiatric professional to help a person through a difficult time. You just need to know what to do. Thanks for watching.